This is Emily. I'm going to be providing my verbal CET report. So my patient was Robert Sturgis. He's in room 301, 81-year-old male. He is being followed by Dr. Donofrio for oncology. No known allergies. Do not know his admit date. And he is a DNR, a DNI. He was admitted for metastatic cancer of his colon. He has a history of diabetes type 2. And then his course of stay is palliative care. He is stable. He is ANO times 4 with neurochecks Q4. And then he's on no IV fluids. And he recently had a CT scan and colonoscopy of his colon to identify his colon cancer and understand and biopsy where those tumors are. Vital wise, blood pressure 114/67, temperature 98.7, pulse of 115, so he's a little tachycardic, but that is known to be a baseline for him. Respiration is 98% on room air. And let's see, skin is intact, warm and dry. He is on a regular diet, even though he's diabetic. Due to being in palliative care, they're letting him eat what he would like. And he's only doing about 25% intake. And then, let's see, no lab values on him, but if there were, I would expect if he's actively bleeding in his colon, his red blood cells and hemoglobin would be low. Or if he was dehydrated, they would be high. Same with his BUN. If he was dehydrated, it would be high. If he had an active infection in his colon, I would expect his white blood cells to be high. And then his blood glucose last was 185. It has been ranging from about 185 to 200. So I'd expect his A1C to be a little elevated as well. Let's see. Action items are pain control and setting up hospice placement for this patient. And once that is set up, he's just currently on his palliative care. And once hospice placement has been determined, that he will be discharged. They're providing 4 units sliding scale insulin coverage with whatever he would like to eat. And then pain was about 7 out of 10, so giving 25 milligrams of Demerol. And then that was all that I could get for a IPASS for this patient. Not much else was included for him. And then moving on to competency 2, his priority medical diagnosis is metastatic colon cancer. This type of cancer usually does not produce symptoms in early stages of the disease. This consists of a tumor in any part of the colon that can be spread to other parts of the body. Bloody stool is the most common symptom. And then it is unknown cause of the cancer. It is often genetic. I would assess for bloody stool or abdominal pain or trouble passing bowel movements for this patient during my assessment, or any specific tenderness of the abdomen. Some nursing interventions are pain management, ice and heat for abdomen depending on what helps, soft foods to help with bowel movements or laxatives, and then contacting social work for comfort care measures. Or contacting chaplains, anything like that the patient would like. Labs I would expect to be done are CBC to check blood counts or CMP to see if there's any electrolyte abnormalities or any labs pertaining to the cancer or cancer levels. Also a CT of the abdomen or a colonoscopy to locate cancer tumors and possible biopsy them. Medication I would expect to be ordered are pain medication, nausea medication, laxatives, and possibly chemo if they're being treated for the cancer. Also, occupational therapy would be helpful in helping the patient perform typical ADLs associated with cancer treatment or living with the cancer. One potential complication for this patient would be a blockage of the colon or a bowel obstruction, which can then lead to further infection. Constipation could cause this for the patient. The cancerous tumor could obstruct the colon and not allow stool to pass through, therefore causing a blockage and potential bowel obstruction. Some clinical manifestations of this would be severe abdominal pain, constipation, vomiting, and loss of appetite. This patient has metastatic colon cancer and is being placed on palliative care. I've moved on to competency 4 now. Therefore, he is not being treated with chemo or radiation. Him and his family have decided to keep him comfortable for the rest of his time he has left. Some health promotion needs for this patient could be reassurance that everything will be okay and taken care of for him by us, his family, and then anything to help prepare him or his family for this process. A local resource is the Reno Cancer Foundation, which is actually located at Renown. These social workers can help him and his family set up hospice and assist through the whole process. Let's see, competency 5. This patient scenario did not discuss any social economic factors associated with him, but his family was present at bedside the whole time. But some questions I would ask are, do you have any fears or anxieties about hospice care? Do you have any financial worries? Is there anything you wish to accomplish? Do you feel supported? These questions could help focus on a psychological level, psychosocial level, to help with other problems just besides the cancer he is fighting. That is it for my verbal CT of everything I could get from this patient. Thank you.